Welcome to the Cardiovascular Surgery series, where I discuss the latest research in cardiovascular surgery from the Mayo Clinic. I will discuss today the interaction of FEV1 and NT-Pro-BNP with outcomes after transcatheter aortic valve replacement. Chronic lung disease is common in patients treated with TAVR. Relieving the aortic stenosis in patients with severe chronic lung disease may not provide symptomatic improvement in the quality of life, or long-term survival benefit in those patients. In this study, we used the interaction of FEV1, a marker of severity of lung disease, and NT-Pro-BNP, a marker of myocardial dysfunction, to identify patients with aortic stenosis and chronic lung disease who will have limited benefit from TAVR. We analyzed 871 patients with aortic stenosis and stratified them based on FEV1 greater or smaller than 60% of predicted, and NT-Pro-BNP greater or smaller of 1600, which was the median for the study population. Groups A and B had mild chronic lung disease, and group C or D had moderate or severe chronic lung disease. Patients in group A had the lowest risk profile and the best long-term survival. On the other hand, patients in group D had the highest risk profile and the lowest long-term survival. 13% of those patients were alive at 5 years, and 25% of those patients had no symptomatic improvement. We conclude that the combination of FEV1 and NT-Pro-BNP stratified patients in 4 groups with distinct risk profile and clinical outcomes. Patients with low FEV1 and high NT-Pro-BNP had increased comorbidities, poor functional outcomes, and decreased long-term survival. These patients had limited clinical benefit from TAVR. Thank you for listening to the Cardiovascular Surgery series.